really excited to introduce you to Dr. Soileau. Dr. Soileau, do you want to give us a little bit about your history and where you came from and your practice?
Sure thing. Hi, everyone. Thanks for spending your Monday afternoon at lunch with us. So my name is Michael Soileau. I'm a movement disorder specialist here in Georgetown, Texas. I know not everyone joining is from Texas, so that's just north of Austin. We have about 3,000 movement disorder patients in our clinic. I'm in a private practice. We have 2 movement disorder specialists and a physician assistant, and treat basically the gamut of movement disorders. And my whole goal was to really take big city training and big city trials and treatment of movement disorders and kind of bring it to our town. And that way patients, at least in our region, won't have to travel quite as far and navigate the big cities. And so that's what brought me into this practice per se. And we do a little bit of everything here. We have certainly residents and students rotate through clinical trials and obviously patient care. One of my most favorite things to do is this. I love educating folks and talking just about current events and things that need to be brought up. And this is a great way to do it in this new age of telemedicine during COVID-19.
Wonderful. Thanks so much. Before we opened up and let all of you in, Dr. Soileau and I were having a conversation about how there seems to be a tendency right now to sort of put your own health on hold unless you have COVID. And I wonder if you can talk about that as it relates to Parkinson's, and not just why maybe we don't want to do that, but also some potential complications if we do that and challenges.
Sure, that is a great question. So that was actually one of my biggest fears that we had and something we were actually seeing. So when folks first started learning that there was a shelter in place, at least in our area, and folks shouldn't be out and about and even going to doctor's offices necessarily unless it was an emergency, what we saw patients start doing is canceling their appointments and then saying, hey, we're going to call you back and reschedule when this thing is over. Well, that concerns me greatly. So already with our day-to-day appointments, we have so much to cover. And our patients have taught me well that if we delay our appointments even a little bit, things start stacking up. And so, caring for the motor features of Parkinson's is one thing, but caring for the non-motor features, that's really what takes the longest and is the most complex. And so if we wait and we don't treat that in a timely fashion and things start piling up, then it starts to really snowball and things get out of control. And so we were trying to warn our patients, please do not delay your appointments. Let there be as minimal disruption to your care as possible, and let's keep things moving. And how we do that, I think, is the neat thing that has evolved just in the last 1 month. I mean, literally on the fly, 1 month, things have evolved so much. And so thankfully, we've seen a turn of events where at least patients in our region have started keeping their appointments, and if not keeping them, even making more frequent appointments just to discuss these things as they pile up, because it's much more convenient for them now. Once they learn how to do this telemedicine, just as we're doing right now, it makes it a lot easier. And then it's very simple for them to jump on a call with their provider, and we can crush any issues that there may be. So.
Yeah, because if you wait, then you end up talking with you, and you have 30 things that you're trying to address, which is overwhelming for everyone. Are you seeing any symptoms or seeing any impact of stress as it relates to Parkinson's with people right now?
That's a great question. So for the next 45 minutes, I'll talk about stress. No, I'm just kidding. So, absolutely. Well, first of all, let me just personally say, I noticed my stress level reduced tremendously when I turned off my news. So I am inundated with COVID-19 stuff from the moment I wake up to the moment I go to bed, and even my dreams. And so, I mean, if it's not from media, if it's not from emails, I mean, literally it's everything we've breathed every day for the last month or so. And I noticed when I started limiting my news and my, current events and things like that, my stress level went down tremendously, first and foremost. And so I think as a good rule of thumb, maybe a pearl for everyone out there, if you can really limit your resources to very reputable resources like CDC or, the PMDA website or Michael J. Fox website or any of these other kind of organizations that can really help, I think you'll be of benefit there, because what we have to be careful in this wonderful day and age of technology is information overload. And not only have my patients experienced that, but I too have had that. And so again, I think stress level goes up dramatically during that time when everyone's trying to focus on this current events. And social media is something that's also contributed to increased stress in our patients. And so we've had several patients call us and ask us questions about these things that they've read on social media. And I've even seen some of these posts myself, drink something hot every 20 minutes, take in a deep breath. And if you have any trouble taking in a deep breath, you may have COVID and you should seek medical care. Just all these things that have no scientific basis whatsoever. And we always tell our patients, we'd much rather you contact us and ask if something is legitimate. And by all means, if we don't know the answer, we'll find out for you and let you know. But we want you to have accurate information. And I think once you know what you're dealing with, there's no need to be scared of it, as long as you respect it. And I think that's what I've learned in the last 1 month. Even when I was bringing my 2 kiddos to Home Depot and getting some stuff for the house, I saw people all around me terrified and not necessarily joyful and at peace, but instead fearful and scared, and not even around each other. They weren't even being nice to each other. And I hated to see that, because being respectful of COVID, the virus, is one thing. Being fearful of it and making irrational decisions, I think, is another. And that's something that we don't need to do in this day and age. We know too much about this. Even now, we know a whole lot about it. And if we can just respect it, I think we'll all be better off. And that stress that we hear with all this, it just plays into our chemistry of our brain in Parkinson's. So my patients know this well, that just like dopamine levels are low in Parkinson's disease, so too can other hormone levels such as serotonin. Those are also low in Parkinson's disease. And just like we have to supplement dopamine on one hand, we also many times have to supplement serotonin and give that back to our patients. And so on top of that, you have life stress that just every day, all day, hey, I have a chronic disease like Parkinson's. And then on top of that, now we have a whole new, by the way, there's a pandemic. What do I do? And I'm the one at risk. Oh my goodness. And that just plays into all this stuff. But hey, that's what we're really good at treating, are things like that. And I'm sure we're going to get into some of the ways to treat stress. But that's just something I've learned quickly in the last 1 month, and my observations that I think we can really do well by paying attention to.
That I think that's so wise, and I think you're right. Like, just limiting the news. I mean, to your point, the fear can make us freeze, right, and act, like, as you said, irrationally. So that's the first order on the prescription pad is to not watch as much news, so you don't feed the fear. And I'm wondering, it made me think about, when you're thinking about stress, and when I think even of the last month or so for me, some of the things that we know we know how to manage Parkinson's. People who are on have had the diagnosis for probably a whole variety of years. In fact, I'd love to have people put in the chat how many years you have had and been living with Parkinson's. And if you're a care partner, we say that you're living with it too. So if you're a care partner or an adult child, everybody is living with Parkinson's. It's just a different manifestation of it. It is definitely a team sport. Thank you. 10 years. There's going to be I'd love to see this. And sometimes I feel, though, with the stress, it's hard to even remember the basics, you know, the things that we started off with that we know how to manage. Wondering if you can even help us kind of press that reset button, like, okay, let's ground ourselves back in this. Everybody's more than Parkinson's, but this is what our topic is today. You
Mhm.
know, what's our reset button to remember the basics?
Yeah, great question. So first of all, I mean, I think we've talked about number one, and that's preventing information overload. Okay, that right there has been a wonderful reset in my brain, and but especially in anyone who has Parkinson's, I think that's important. The second is making sure that you keep a perspective. Okay, so this too shall pass. It will. We will get through this. I'm very hopeful. I'm a hopeful person in general, but we know this. We know this will pass. And I think keeping that perspective is important. So how do you do that? Well, the first is I think you maintain your connectedness with your family and your friends. So one good thing out of all this that's been that we've seen so far, not just in our patients, but even me personally, is there's more time to spend with your family, more time with your caregivers. You know, you can really get to know them on a whole new level when you don't have the distractions of the world these days. And it's been wonderful. We've been forced to stay at home and enjoy each other's company, and that's been wonderful. So I think number one is just realizing who's around you and getting to know them again. Okay, I think that's very powerful. Number two, I think the other way to do the reset button, press the reset button, is to make sure we're not neglecting our Parkinson's disease and the symptoms of our Parkinson's, which this whole webinar is about today. We'll get into some of those details a little bit later. Number three, I would say very important to keep in mind your exercise. So just because there may be a shelter in place, for example, doesn't mean that we can't get out and walk in our neighborhoods. It doesn't mean that we can't walk in around our home, perhaps, or even do exercises. If we can't walk and we're in a wheelchair, we can even do exercises in our wheelchair, and we can make it fun. You know, there are YouTube videos and all kinds of resources online to help our patients do chair yoga, you know, all kinds of classes to music. You can even pick a genre of music and a time period in music and do exercises to that music for free just on the internet and right from the comfort of your living room or wherever you may be. And I think that's important, is that we don't neglect our exercise, because the tendency is to stay at home and to be bored, right? Because you don't have as many errands that you can run or projects that you can do. And so we sit at home and we'd rather sleep, because what do we do when we get bored? We either watch TV or we sleep, right? And so I think it's important for you to remember, not neglect your exercise, because guess what? Our patients with Parkinson's know this well, that if you miss even a day of your exercise, what gets worse? Tremor, thinking, speaking, everything gets so much worse if you miss even a little of your exercise. And even our some of our boxing programs in our region, they've moved to a virtual platform where everyone can participate and still do the boxing and all kinds of things. And I think that's all a big, huge step in the right direction. And then once you kind of honed in on those things, we've talked about getting to know those around you. We've talked about limiting information overload. We've talked about not neglecting your Parkinson's symptoms. We've talked about not neglecting your exercise. I think the other thing, if you still haven't found your reset button pressed by then, I think it'll come to light after you finish those first 4 or 5 things. Because I know even for me, without Parkinson's, it's helped me, and I know it'll help our patients as well.
I mean, that's just super helpful. Just kind of, and just to pick even a couple of those things, if you feel kind of stuck, if you feel sort of paralyzed, what I like too is some of the things you mentioned are things you can do if you can't go out, if you have a shelter in place, you know, and you're really encouraged not to necessarily leave your home. I love the concept of just turn on music, pick a genre. I love that.
A great example of that is much to my, well, I don't know if my family likes this or not, but I've said now's a great time to start piddling around on the piano. And so, you know, everyone goes outside whenever I play the piano. I don't know why, but who cares? It's a lot of fun, and it can, you know, it's a great time to pick up a new hobby if you would like. And so music is, it's really amazing how music in and of itself, during times of just absolute chaos, you can, whether you're playing music or listening to music, it can really bring you back down to a new center. And I've really enjoyed that lately, even personally.
There's some research, right, that, I mean, music definitely stimulates, so the neurotransmitters and
That's right.
gets the brain activity going a little bit.
Correct.
Absolutely. You know, we talked about the stress a little bit. So what kind of things should people watch for with, you know, stress as it relates to Parkinson's, and what kind of things could people do to deal with the stress?
I think the number one thing I hear from patients is I've been way more stressed and my sleep is not good. So I don't know how many of you out there echo that, but sleep is one of the biggest issues that we hear right now. Again, same idea, lots on your mind. You try to go to sleep and your mind's just churning, all these things to worry about. And then what happens is you get a poor night's sleep, and then next up is the next day, and you feel like your concentration is not as good. You're not moving as well. Maybe you're freezing more. Your tremor is not as good because you're sleep deprived. And I think there are a few things that we've found to be very beneficial. The first is going back to the basics of sleep hygiene. So a good example of that is when I feel my mind start just racing and just churning at bedtime, and I realize that I'm quickly on the path of not getting to sleep, the first thing we should do is get up from our bed, go to a different place, perhaps read a book, perhaps do some meditation or praying, you know, basically get away from the bed for a second. No phones, no TVs, no computers, no news, you know, things like that. Not stimulating things, but more things to kind of bring us back down. And we will start to feel sleepy again at some point. And only then should you get up and go back to your bedroom. I think the tendency for most is to, I'm in bed, and we've all been there, right? You look at the clock and you say, ugh, it is 2 a.m. I should be asleep. I've got an early morning. And then you close your eyes and you look and it's like 2:05 and you're like, oh my gosh, it's only been 5 minutes, right? And there's a name for that called psychophysiological insomnia, and that's a well-known medical condition. And there are things that we can do, such as the sleep hygiene, like I just mentioned, you know, limiting caffeine before bedtime, you know, drinking some non-caffeinated tea or hot milk or something like that can be soothing as well. You know, so things like that that we can do to help out with the stress. The other thing is that I'd also have patients to remember is, especially in our Parkinson's patients, we've had patients contact us saying we've had increased panic attacks. But remember that it is different in our Parkinson patients. And so one of the ways that your body may tell you that your dopamine levels are falling is that you can get panicky on the inside. And so the very next question that we always ask our patients is, what time are you having those panic attacks? So let's say that I take my carbidopa levodopa, or the Parkinson medication, at 8 a.m., noon, and 4 p.m., okay? And I notice that I'm beginning to get more panicky or short of breath or feeling very anxious around 3:30 p.m. or 3 p.m., but I'm next due at 4 p.m. That may be a very good clue that your dopamine levels are falling. And so we don't treat that with mood medications, or, you know, if you call your primary care doctor, they may give you a short-acting mood medicine, but that's not the way that we treat anxiety or panic attacks in Parkinson's, but we actually pay attention to the dopamine. So we would actually change your dopamine in that setting. So don't neglect the timing of your anxiety. is what I'm suggesting, because that may be more than just anxiety. It actually may be wearing off dopamine.
So that's one of the things people can really pay attention to and watch for that trigger, that increase in anxiety. And then when somebody does talk with you about that, can you talk a little bit about how you do address the dopamine issue then? I mean, there's a variety of different kinds of treatment options, right? I mean, there's a lot of different ways to do that.
Absolutely. So that's kind of a little bit of a loaded question, but a great one. And the reason it's a great one is because the cool thing about my job is there's no one recipe for anybody. And that's kind of the neat thing, is we can figure out your perfect recipe for your symptoms. And I would say challenge number one for anybody with Parkinson's is knowing how to listen to your body and knowing what your body is trying to tell you. And that's one thing that we're always working with our patients on, is how do you know when your dopamine is wearing off? And so I would go back to the two primary things that we try to teach our patients. Is it's not about your total number of pills per day, let's say. It's about your number of pills and the time that you take them. So for example, there are two goals with any treatment in Parkinson's. The first one is, can I take a medicine to get my dopamine level into my sweet spot? That's goal number one. And the second thing is, does that medicine keep me in my sweet spot until the next dose? Okay. So how do I address this panic attack in patients whose dopamine levels may be falling? It's going back to those two primary questions. So what dose did you take right before that? Okay. Is that even a high enough dose to get you into your sweet spot? Because what may happen is, if your sweet spot's here, you may be kind of operating underneath your sweet spot with your medicine. And so we in that case, we would just give you a bigger dose so that you can get within that window. Then number two, let's say that you take that medicine and you get in your window or your sweet spot just fine. You're just not staying there. Let's say you're wearing off. Well, then we have a variety of things that we can do. I mean, we have clicker pens that can give you medicine on the fly. We have inhalers that can give you medicine on the fly when you need it in a pinch to bridge the gap. We can make adjustments to your oral medicines that you're on already. We have other oral medicines we can even add on to make that medicine last longer. If that's too much or too cumbersome and you're taking medicine every 2 hours and you're like, well, how can I take more? I mean, I'm already eating pills for breakfast, snacks, lunch, and dinner. Then we have pumps that can deliver medicine continuously, where you don't have to worry about the ups and downs as much. And if you do have an off time, you can press a button to get a bolus or a boost of medicine. So I say that not to overwhelm everyone out there, but hopefully to encourage everyone that we're very blessed that we have many options to treat those wearing off symptoms. But what that option is for you as the patient, or for your loved one if you're a care partner, is depending on what the perfect recipe is. And again, that's something to discuss. And then bringing that back around to telemedicine. So now, if you're having more of those issues, rather than us trying to sort through this over the telephone, and rather than us having to make an appointment for you to, possibly get out of your house and get exposed to all this mess, we can just do this, a telemedicine appointment, and clarify all that stuff. So again, long-winded answer to your question, but I think very important question, probably the most important, is what you just asked.
Yeah, and I think I'm glad that you took the time to explain it, because I feel like, we really are blessed. I mean, we've gone from, having just Cinnamit to having many medication options, and thank goodness. And the whole idea is to make sure that we're actually using them for the right
Right.
person. Yeah.
Correct.
Which makes me think about, now's the time, we really, if I'm going to say that there is a little bright spot that has come out of this, you're always trying to look for a little something bright. We really have been able to expand the telemedicine, and we've had some conversations about that. But I think one of the pieces is that there are a lot of people who don't live near a movement disorder specialist. And so they maybe see a general neurologist or maybe don't even see a neurologist at all. And now we don't have to have that. And so if there are people listening that don't see a movement disorder specialist, now's the time to see a movement disorder specialist. And can you share a little bit about what that difference is, what the movement disorder specialist brings to the table?
Sure, I would love to. So it's one of the most common questions we get from our patients is, well, how do we know when we should be seeing a movement disorder specialist? So first of all, I would say I almost feel like sometimes we're a rare, extinct species because there just aren't as many movement disorder specialists as I would like to see out there. But again, with things like telemedicine, remember, if you have Medicare, traditional Medicare, for example, you don't need a referral anywhere in the country. You can see a provider without a referral. So because it's a national plan. Now, if you have, a Medicare replacement or a Medicare Advantage plan where it goes through a big health insurer, you may actually need a referral. But then for folks with traditional Medicare, you don't. And so a great example of that is someone who, we have many who live in West Texas, for example, that drive 10 hours to see us and may, have to take off 2 days of work because of travel and appointment, get a hotel room, all these things. And now we have something like this that we can utilize that would save them all that money, all that travel, and the complexity behind that. So that's been wonderful. Um, I often also get asked, we have all these wonderful things to treat Parkinson's. Why haven't my doctors all this time told me about this? And I'm gonna be fair to them. I just recently had a friend of mine ask me questions about multiple sclerosis, okay? And that is an area of neurology that has changed so drastically in the last several years, even the last 1 year, that I can no longer keep up with the ins and outs of that because I've solely specialized in movement disorders. And so for someone to ask me a question about MS, let's say, it wouldn't be fair to them because I don't know all the ins and outs. I can tell you the gist and I can tell you some of the things that are current, but I certainly can't pretend I'm an expert and do that day in and day out because that's not what I do. I do this, I do movement disorders. And so to their credit, for folks who are seeing a general neurologist, they're doing the best they can with everything, every aspect of neurology. There are something like 23 different specialties in neurology alone that your general neurologist is expected to know a little bit about a whole lot. As opposed to someone like a movement disorder specialist who's gone through 4 years of college, 4 years of medical school, 4 years of residency training, and then sometimes 1 to 3 years additional training after residency just to specialize in movement disorders. And that's what we do. And so I would encourage folks to, if you have this disease, Parkinson's disease, or really any movement disorder, I think it's imperative that you at least get an opinion from a movement disorder specialist. By all means, some can still simultaneously see their general neurologist, and we have those patients too. Some general neurologists feel very comfortable with this stuff, and so they say, well, hey, I'm going to co-manage you with the movement disorder doc, and he'll make suggestions perhaps, and then I'll follow them, and I'm cool with that. Others say, wow, this is pretty complex. I'm going to just scoot you over to the movement disorder specialist, and that's okay too. But what breaks my heart are, let's say that a patient should be a candidate for an advanced treatment option like deep brain stimulation is a great example. And the patient's had Parkinson's for 16 years. And the general neurologist says, well, I don't know what to do at this point. Let me get another opinion from a movement disorder specialist. And actually, there's something out there called deep brain stimulation. I want you to look into that. So patients go and they get on YouTube and other places and they see these remarkable videos, these just miraculous videos of patients, tremor, just all over the place, and they turn on their DBS and it stops. And then the patient and their family says, I want that. And then they come to my office, but what if they're not a good candidate any longer for an advanced treatment? And so I said, oh man, if only I would have seen you, 5 years ago or 8 years ago or something like that. And those are just made up numbers, by the way. But that's a great example of how early is better, in my opinion. And where some movement disorders, general neurologists may look at you and only treat what they see, a movement disorder specialist is looking at you and treating what they can't see. So remember, we talked about those those non-motor symptoms, the constipation, the urinary urgency, your cognitive concerns, your sleep concerns, swallowing, drooling, you name it. We're dealing with all of these other non-motor symptoms that may or may not occur in Parkinson's disease, but we don't just address how you move. We address all those other things. So again, because of that complexity, that's why we narrow our practice to just movement disorders in our case. But I would encourage all of you to please spread the word that if you have a movement disorder and you haven't seen a movement disorder specialist, I would encourage you to do that.
Oh, I've never heard somebody talk about, you're right, the movement disorder specialist is able to not just address what you see, but what you can't see. Mm-hmm. And those oftentimes are the symptoms that are far more complicated and impact quality of life so much.
Yep. Absolutely.
Yeah. I like to tell people in our live programs, if you don't see a movement disorder specialist, we definitely want to encourage you to see one. If you don't know if you're seeing a movement disorder specialist, feel free to reach out to us. If you don't know how to find one, we do have listings on our website, and there's a listing on our website which takes you to the Movement Disorder Society, which has an up-to-date list of movement disorder specialists as well. But, we would never think twice. If we had cancer, we would certainly go to the doctor who had the most expertise about that particular kind of cancer. We would not even think twice about it.
And the other thing I'll add to that comment is whenever I speak to patient support groups, it's not an uncommon thing for me to hear, I've learned more in the last 45 minutes than I've learned in 15 years. And I think that is something that we pride ourselves on, is if patients don't understand the why of what we're doing, they'll never understand the strategy. I mean, this is all an art rather than a science. It truly is. Again, we talked about creating that perfect recipe, and so I think it's important for patients to understand why we're saying what we're saying. And what's really cool for me as a provider is when I see these patients, the light bulb go off and they say, I get it. I understand now exactly what you're doing. And then that way, when the patient calls, they're talking apples to apples with you. If they say that they're having a tremor, then I know they know what a tremor is, as opposed to wiggling movements or dyskinesia, for example, which may mean two completely different things. So for those of you who don't know, remember, oftentimes tremor, which is just that back and forth motion of a hand or a head or tongue or whatever, leg, whatever body part, a tremor usually means that you need more medicine, that your dopamine is under your sweet spot. But if you're moving too much and you're wiggling and you can't control those movements, then that usually means for most that your medicine is a little above your sweet spot. And so again, two completely different things. But if a patient calls me and says, hey doc, I'm moving too much, I don't know on face value whether that means, hey, I need more medicine or I need less medicine. But as soon as this call connects through a telemedicine visit just like this, I can tell just by observing them whether they need more or whether they need less. And some patients are also getting really good at doing what are called motor diaries, and we have charts that make this so easy for you to where it's not cumbersome, but you literally check a box with how you're feeling, if you're moving too much or not moving enough and you're freezing. And we can see a pattern. I just did this with one of my patients the other day where we could not figure out the pattern over the telephone. We had a telemedicine visit. I said, I'm going to send you a motor diary, and I want you to do this for 5 days and send it back to me. And we did that, and we figured that the pattern that they were having, the reason they were feeling so poorly was because their blood pressure was dropping after they ate their meals. And that was the culprit. And once we figured that out, we treated it, we're good to go. But having to explain that over a telephone is really hard. So until we were able to assess that motor diary and have that little bit of information, we were kind of lost until we had some guidance on how to troubleshoot those symptoms. So that's just an example of many that we often use on how to hone in on this motor diary and motor symptoms, I should say, so that we can fine tune your meds and treat that.
And that is something that a movement disorder, specialist would use, frequently. And understanding, I like your example because, not everybody knows that blood pressure can be tied to Parkinson's.
Yes.
And can be actually a really significant issue for people with Parkinson's. But a movement disorder specialist would definitely do that. I have a couple questions in the chat here. Someone sent me a question asking, how do you approach seeing a movement disorder specialist for the first time as a new patient through telemedicine?
Great question. So there are some resources that can help you online of sheets that help you basically hone in on what's important. A lot of our patients in our area, in our region, already use this. I know that, just to take a second and brag, we have one of the absolute best Parkinson's support groups here in our region. It's called GAPS, Georgetown Area Parkinson Society. Also a subset of that, GADS, is our DBS support group. But just a phenomenal set of people, some of whom I know are on today. And on their website, for example, there are some resources made available to them that really help you hone in. One thing, I've had Parkinson's for 15 years, and I'm seeing a movement disorder for the specialist for the first time. Where do I start? That can be so mind-blowing to people. And by the way, we, in our clinic, we offer 45-minute new patient consults. And so we only have 45 minutes to cover 15 years worth of information, right? And if you're seeing a general neurologist, you may only have 20 minutes or 30 minutes, So these worksheets really help hone in on what's important. And some of those include, what are my motor symptoms I'm most concerned about? Is it freezing? Is it wearing off? Is it troublesome wiggling or troublesome dyskinesia? Another one is, what's one thing that I can't do now that I wish I can do? These are just things that can really help us. And I would say the most important thing when you see a movement disorder specialist, really any doctor, for the first time, it's when you're on 1,000 medicines, we understand it can be overwhelming. And there's about 7 different versions of one particular medicine. And so that can be just overwhelming as well. So if you're unsure what medicines you're on, have your pill bottles right there beside you. Or once we start opening up to live visits again, bring those with you. And then our staff can kind of go through those one by one, so we can make sure that when you tell us you're on, for example, Cinemet, there are so many different versions of that. We want to make sure that we're inputting the correct one, because that matters how we make your recipe, if you will, to help with your motor symptoms. When I'm seeing a patient, it's not as important to me as much about their past and their Parkinson's as opposed to understanding what medicines they've tried and failed, and then understanding where they are right now. Because really, if the way I always say it is, if other folks would have figured it out in the past, you probably wouldn't be in front of me right now. And so what I care about is what I see in front of me. And I see a problem that you're not able to move. for example, and I'm going to fix it. And so if I can just understand what medicines you've tried and failed, so we're not reinventing the wheel, I think that's what's going to lead to most success. So in other words, don't make it complicated, stick with the basics. When we see patients in front of us, we know how to fix them as long as we understand their medicines. And that's really the most important thing.
Wow, that makes so much sense. The medication that you've tried and failed, that just
Yep.
makes, I just think of, I mean, I don't know that I'm sure a doctor asked that, but that is not necessarily something that you think about bringing in to the doctor's appointment. And to your point, you don't necessarily need to know 15 years. You need to know that's just super
Yeah.
helpful.
Mm-hmm.
One person asked a question: is there a standard time between appointments? It seems like my husband's specialist gives appointments 6 months out. And by the way, her husband is 87.
Mm-hmm. That is a great question. And I would say there is nothing cookie cutter about anything we do, nothing. And so at least, and I can't speak for every clinic around the country, but at least at ours, what we try to do is to have the patient seen at least every 3 months. Now, there are patients, let's say I'm seeing someone for the first time, and the patient I see before me, we have a lot of work to do. I know we can tee them up. I know we can make things better, but it's going to take some work. We may see them once a month. We may see them next week if we need to. It depends on how sick they are. And so I would say there's nothing cookie cutter. Now, for a stable Parkinson's patient, where we haven't made in our clinic, we haven't made any changes in the last visit or 2 visits, and we're just coasting, by all means, every 6 months, I think is completely fine. Now, the reason I said our clinic is because, again, you don't know if something's broken unless you ask about it. And so it's real easy if I'm looking through this lens and I'm only treating tremor, for example, and what if the patient's not having tremor? I can say, hey, you're stable every 6 months. But when I take those lenses off, there's a lot of other things going on, like those non-motor things we talked about earlier. And so again, I think that for those things, I would say at least every 3 months. That way things don't pile up. A great example is constipation. If you go 1 week without addressing constipation, guess what happens? Your medicines don't work and everything falls apart. So whether or not your medicine works well is dependent on how good of bowel movements you're having consistently. And so imagine if we delayed all that for 6 months and we didn't talk about it, then you've had 6 months of hard times, all for something so easily fixed. And that's why we don't wait too long. Now, I will say this, and I know we share this in our movement disorder clinic. We share this with other movement disorder clinics around the country. Since there aren't as many of us, you can imagine there's such a need, but the supply is so small of movement disorder specialists. And so again, we can't do this by myself. I can't see every single patient as often as I want to by myself. That's why we have a whole team of people. We have a physician assistant, other clinics have nurse practitioners, some clinics have social workers and all kinds of people that really help them treat patients with Parkinson's. And so I think it's important to remember that it doesn't always have to be with your doctor, but it needs to be with someone on the care team, because this is all we do in our clinic all day, every day. But in our clinic, we try to blend that. So patients will see our physician assistant one time, and then maybe the next time see the provider, the physician, I should say. But let's say there's a lot going on, and there's a lot of tune-ups we need to make with the medicine. Patients may see our physician assistant for a couple of times or even a few times frequently, kind of with short periods, so we can actively make changes to their medicines. And then by the time they see the physician next, they're in a much different spot and they're tuned up. And then we can take that person in front of us and then move from there. So again, great question to whoever asked that, because I'm a firm believer of more is better in terms of seeing your provider. And back to our very first original point, I do not want patients to cancel their appointments during this time out of fear because of the virus, because all these things can pile up. And guess what? Down the road, when this blows over, which it will, those slots are also taken with patients. So I don't want there to be a shortage of availability for you to see a provider. And again, it's not just our clinic that worries about that. Almost every movement disorder clinic around the country is undergoing the same thing. You know, when I've talked to patients in Washington, or I'm sorry, providers in Washington State, or California, or really all over the country, it's a small world. They're all undergoing the same concerns, just as we are here in Austin area. So very good question, whoever asked that.
Yeah, and I'm really glad you brought that up, because that relationship, I mean, you guys, one of the movement disorder specialists that we work with talks about, that's one of the things she loves about your job and this particular field, is it's a long-term relationship. So make sure it's a good synergy with your doctor.
Well said.
And yeah, because it is, it matters. And to your point, you don't want to save up. So again, I like that we are emphasizing, again, do not put, Parkinson's doesn't have a pause button, and so don't pause it during telemedicine.
Yep.
Let's see, we've got some other questions here. We've got, are there any medications that would help with anxiety?
The answer is yes, there are many. So we have medicines, again, that can focus on dopamine. If dopamine levels are the problem with the anxiety, we have medicines that focus on the chemical serotonin, if that's the culprit. And again, non-medicinal things such as exercise, swimming, music, all these things we talked about at the start of the broadcast, those are all helpful too with anxiety. Without being more specific, yes, the answer is yes, we have tons.
Excellent. And that's something to definitely talk with your doctor about. And for care partners too, right? I mean, if the person with Parkinson's, or adult children, or, somebody close to you, if somebody else is seeing it, they can also share that information with the doctor. Even if you can't reply back to them, they can at least share that with you.
Yep.
I think sometimes people might forget that they can actually share that information. There's a question about, what does inner tremor mean?
Yeah, great question. So not just in Parkinson's disease, but a lot of movement disorders, patients will say they feel like their insides are tremoring. It's nothing that I'm able to see with my naked eye. It's something that only the patient can feel. And again, in a patient who has Parkinson's and maybe has an internal tremor, the key there is to look at your watch and see, when are you having that tremor, and where in your window of medication is that tremor happening? Because if it's at the beginning, then that may mean that you're in need of a bigger dose of the medicine. If it's at the end, that may mean that we need to make some adjustments as well to your dopamine. But people with essential tremor that's not Parkinson's, or familial tremor it's sometimes called, they also can have inner tremor. And again, that's treatable as well, but with a whole different set of medicines.
Perfect. Okay. And let's see, another question. So my husband is in an assisted living facility. He has dementia as well as PD. The facility is on lockdown, so I'm not able to take part in telemedicine session. Would it be helpful for the nurse at the facility to sit with him to answer medication questions?
Great question. And so again, just to take a little time and brag about some of our patients, I can't tell you, I wish I could say a big fat I told you so, but all of our patients had such, they were so intimidated with the technology and that barrier, and oh, I could never do this. And one of the coolest things I've seen so far are some of our patients do this successfully, just kind of like we're doing here today. And then they are beaming, they are so excited, and they are just telling their grandkids, hey, look what I did. And I love that. And so we have also done that in assisted living facilities and nursing homes. So for those patients that are on lockdown, we've been able to successfully get someone at the nursing home to bring over a tablet or a phone or a laptop where we've been able to have this visit just like this, been able to see the patient, been able to ask questions. Even better, I would say we were able to ask the nurse at the facility as they were sitting there, hey, tell me how, Mr. Brown is taking his carbidopa levodopa without getting just a paper that doesn't make sense. We have someone right there that we can ask that question to. I would say the only challenge there is, let's say the care partner wants to be on the line at the same time that the patient is on the line. Some platforms have that ability to do that, but not all. And so what we've done in our clinic is actually just getting some of the nurses to help facilitate those questions, or maybe the care partner will call us ahead of time and say, here are my top 2 concerns that we need to address. He's not able to tell you this, but I am, and then we can address that with the nursing staff and the patient. So being in a facility should not exclude you from taking part in this. And we've been able to successfully help many facilities get up and running with this platform that we use. Again, everyone uses a different platform, but ours is pretty simple and straightforward. And so facilities have had no issues there.
That's fantastic. And we might just circle back with you about some of that, because I think that is such an issue. And for those of you that are on, I just want to mention, we do have support groups. We have a support group every week for people with Parkinson's, and actually anybody can attend. We have one for care partners and adult children on Thursdays. And then on Fridays, we have a support group for people who have loved ones in facilities, because we know you really can feel at a loss, especially since you can't visit right now. So that's available on Fridays for loved ones with people in facilities. So we welcome you to that. Few more questions. Can you make DBS changes by telemedicine?
Hey, great question. So one of the things we've had to really improvise with and make changes on the fly is taking some of these advanced therapies that we offer. Some include Duopa, that's the pump that delivers levodopa continuously. Others have deep brain stimulators, or DBS. So the way we've programmed many of our patients, we have the leeway to go up and down on settings. Even the patients would have to do that themselves, but we walk them through virtually how to do that. We don't yet, and notice I said yet, have the ability to remotely control deep brain stimulators and pumps, from the office. But we do have the ability to walk patients in doing that step by step. So a great example is either in a DBS patient that's having certain symptom, maybe it's tremor or something like that, we can go up or down on the settings, walking them through how to use their patient programmer. The other thing that we've done with Duopa pumps, for example, is we've been able to walk the patients through how to go up or down on some of their settings in real time. Because again, one thing that's challenging for some patients, they may have the ability to go up or down on a setting, but does it make sense to go up or down? How do I know what side to change on my DBS, the left side or the right side? How do I know whether the symptom I'm having means I should go up on my DBS or down on my DBS? And that's what we can help with. So, and to take that a step further, let's say that we're limited by our window of how much up or how much down we can utilize virtually like this. What we can do in the setting of Duopa, let's say the patient has come to our parking lot, we've come down, we've gotten their pump, and then we've taken it back to the office, we've reprogrammed it with broader ranges to go up or down, and then we've taken it back down to the parking lot so that patients can plug in their pump, restart it, and then now, without ever having to get out of their car or expose themselves, we've been able to control their pump. And now virtually we can go either higher, even higher or lower on their settings. That's just an example of what we've done.
That's great. And so again, you're reiterating that we can do what we need to on telemedicine. So don't put your issues to the side.
Right.
One question is about Botox, though. What about Botox injections for dystonia being delayed due to COVID-19?
Great question. So there are many different policies on this depending on what part of the country, what county, what state the patient lives in. Our policy and what we've done with approval from our state regulatory agencies is, if someone with dystonia delays their botulinum injections, that's a pretty big deal. They can have very disabling dystonia come back, and that's not acceptable in our eyes. So that would be considered an important procedure to have. And so in our clinic, we're doing probably 98% telemedicine, but the only 2% that we actually see are our DBS patients who absolutely need an adjustment, or our botulinum injection patients who absolutely need injections. Because any delaying, or I should say any delay in giving those injections would cause harm to the patient, and we don't want to do that. Now, if it's something, let's say we're injecting a patient for sialorrhea or drooling, that's a fancy term for drooling, or too much saliva. Let's say the patient's doing okay right now. They're not having too much, and we're able to control that with medications. Maybe we can get by delaying that injection, no problem. So we're asking the patients before we schedule, are you in need of an injection or not? If the answer is, I'm doing okay right now, then we'll just wait and inject those patients when able to do so more safely. Otherwise, we would consider it to be pretty important for them to get in and get their injections.
Thank you for bringing that up. You're right, that you don't want to delay that. And so I think, there's been some comments and questions, people trying to figure out how to get to the right specialist, figure out how to connect telemedicine, and please do feel free to reach out. You can always email us at info@pmdalliance.org. We'll make sure that you get the information and get you connected. There are lots and lots of resources out there. Dr. Soileau, I think we could do like a whole nother hour, but I am aware that we've gone through our time already, and it has been just a wealth of information. I can't thank you enough for spending an hour with us today.
Sure. I thank you to everyone, all 65 of you who took time out of their lunch and connected virtually. And I hope you continue to spread the word of some of the things we've talked about. And if we didn't get to your questions, please don't worry. There will be more of these where you'll get a chance to ask questions. And so again, thank you so much for inviting me. And Sarah, thank you for doing all you do for the PMDA. I really appreciate it.
Oh, thank you for being a partner with us. It's wonderful to be able to collaborate with you. So if everybody can turn on your camera, if you have it on, we'd love to be able to wave to everybody. And thank you all for being here. Be sure to join us for our next live stream. We have something nearly every single day right now. Support group will be tomorrow. We have another live stream on Wednesday, and we will continue to answer your questions. And thank you, Dr. Soileau, for everything you're doing for the community and for giving us so many ways that we can stay connected and take care of ourselves.
You're welcome. Y'all stay safe out there.
Thank you so much. Bye-bye.
Bye-bye.